Hi, everyone. I am Liz O'Donnell, the Director of Education for PUSH. If this is one of your first times joining us, PUSH is a stillbirth prevention nonprofit. We are strong advocates for working towards preventing stillbirth in the United States and improving outcomes for birthing people and their families. I'm really excited today to welcome Dr. Hanna from Baylor College of Medicine. We will be discussing a condition that I feel like I was not well versed on during my pregnancy. I've certainly learned a lot about it since, but Group B Strep or GBS. July was actually Group B Strep Awareness Month, and so I definitely saw a lot on Instagram and the like during July about Group B Strep. And then when I got in contact with Dr. Hanna after seeing his contribution to an article, I was like, I would love to have him on the Instagram. So thank you so much for joining us, Dr. Hanna. I'll give you a second just to introduce yourself, and then we'll get right into talking about GBS.
Well, thank you for having me again. It's a pleasure to be here. My name is Morcos Hanna. I am a neonatologist here at Baylor College of Medicine. So I take care of babies who are born either prematurely or babies who are born at full term, but who are sick with any number of sort of conditions. So that's what I do.
Yeah. Well, thank you. And so, when I was looking up different people to possibly have come on to talk about Group B Strep, obviously I saw you and I was just reading. So, and I want to make sure I have this correct. It's 1 in 4 pregnant people and carry the Group B Strep strain. Am I saying that right? Or is there a certain way?
Yeah, no, you're correct. So about a third of moms are colonized, is sort of the word that we use with this bacteria.
Yep.
And the majority of them are not symptomatic. They don't have symptoms of it. But about a third or a quarter to a third of moms have this bacteria sort of living in them, on them, and they don't know it and they don't have symptoms from it. And not just pregnant moms. This is just universal, like all like people.
Yep.
And the reason, and because it's not symptomatic, it's not something that will frequently cause symptoms. That's why pregnant moms go through universal screening. So every pregnant mom will get screened for this infection or for this bacteria, I should say, to see if they have it. Because even if they have it, it doesn't mean that they'll have symptoms from it.
Okay. And so when are you screened for that? And what is that process like?
Yeah, no, it's a great question. Usually it's towards the end of the pregnancy. So sometime around 36, 37 weeks gestation. So typically full term is 37 weeks and above. When an OB tells a mom her due date, the due date is based on when the baby would be 40 weeks gestation. We think in terms of weeks, not necessarily months. So 40 weeks is sort of when the due date would be. The screening guidelines, as recommended by sort of the academies, are at 36 to 37 weeks is when all moms who are expecting should be screened for this GBS bacteria. And the screening process is really just a swab of the rectovaginal area. So they'll just take a swab, they'll swab the vaginal area and go down to the rectum, swab there, and just send it to the lab to test it for culture to see if they have that bacteria.
Okay. And then if the results come back and you realize that you've tested positive, what does that mean for your birth plan? Does it change anything? How does that look if someone tests positive?
Yeah, so the biggest important factor piece to this is getting or preventing the infection from going to baby. Essentially, the goal of testing is to find which moms have this bacteria who may not know it, and then giving them antibiotics or certain criteria of moms who have this infection or bacteria will require antibiotics to prevent the baby from acquiring the bacteria. So typically, the short answer is when the moms are in labor, if they tested positive for GBS, they will need to be on antibiotics, typically penicillin, to prevent the bacteria from being transmitted to the baby.
Yes.
There are some cases in which the moms may not necessarily need the antibiotics. One of those cases, for example, is if the mom is not in labor at all and she has a planned C-section. So her water never broke, she's not in labor. The risk of the bacteria sort of getting to baby is very low because her membranes are still intact. She's not sort of in labor. The baby's not coming out from the vaginal canal. Then in those circumstances or in that situation, antibiotic administration is not necessary. But if the mom is in labor, if her water sort of broke, then there is a risk that the bacteria can then ascend up the sort of the vaginal tract to baby. And then, or if sort of as baby is coming down the birth canal, then baby can, through direct contact, can acquire the bacteria that way.
Yeah. And so when thinking about, GBS as a risk factor for babies, we are a stillbirth prevention organization, and we have spoken with quite a few families who had Group B Strep contribute to their stillbirth. And so how does GBS connect to, we know that stillbirth is rare, but it's happened to us. So we also know how serious it is. How does Group B Strep possibly connect with stillbirth? And in addition to, of course, the antibiotics, is there anything else that we can do to make sure that we can prevent a stillbirth if possible, if someone tests positive for Group B Strep?
Yeah, it's another very good question. So I think the important thing to know here is that GBS can be transmitted to the baby either during or sometimes even before the baby is born. So if the mom has the infection, again, most moms would typically just have an asymptomatic or sort of the bacteria colonized, but not necessarily have symptoms. But if her water broke and she is, and a long time has passed since her water broke, then there is a risk for the bacteria to ascend to baby and potentially infect the baby. So sometimes if mom's water breaks weeks and months before the baby's actually born, and those babies are at risk. If those moms have GBS, those babies are at risk for potentially acquiring the infection while they're still inside of mom's uterus, and then potentially getting very sick from it and leading to stillbirth. Those are rarer cases. Typically, OBs are monitoring moms whose water broke or sort of broke. But I think one thing to know is as a mom, if sort of your water breaks, you should go to a hospital to be monitored, especially if the baby is preterm. Because those babies are even higher risk for acquiring the infection or the infection being transmitted to them if the baby is less than 37 weeks gestation.
Right. And at that point, you may not have already been tested for GBS, so you wouldn't even know.
Correct.
Right. Yeah. And I'm curious as to what, I know you said many are asymptomatic. What are some symptoms that you would know, that you would realize?
If a mom has GBS infection?
Yeah.
So in moms, it's actually the symptoms for infection are a bit more obvious than the symptoms for infection in a baby. Moms would typically have a fever, if she's in a
Wow.
hospital or sort of in getting healthcare, her white blood cell count might be high, which is a marker of an infection. She could have tenderness around her uterus. Discharge from the vaginal canal that either like foul smelling or sort of abnormal discharge from the rectovaginal canal. Those are typical symptoms of an infection. It doesn't necessarily point to GBS specifically,
Right.
but all of these are typical symptoms, but they can be GBS, they can be other infections or like a number of other infections as well. But the GBS in a mom would present similarly to other infections with those symptoms.
Okay. So, yeah, if you notice something off, it's not just a normal part of pregnancy, you should definitely seek a provider to figure out what's going on. And so, a lot of times when we work with families, we are told that moms are worried or nervous about bringing things up. They don't know how to bring up these conversations with their doctor, especially those who have previously experienced a loss. And so for our families that have experienced loss, tested positive for GBS, how can they advocate for themselves, even in the earliest doctor's appointments, around their screening and care if they've tested positive for Group B Strep? How can they advocate for themselves from the very start?
Yeah, I think one thing to know as well is that I think addressing from if they have any hesitation or fear to even like bring up the topic of GBS, I think one important thing to know is that this is not a sexually transmitted disease. I think that's important to comment because there might be some sort of assumptions or presumptions that people might have if they find out that they're GBS positive and not want to talk about it with other people or bring it up sort of out of embarrassment. But this is not something that is considered an STD. This is just a bacteria that naturally lives all around us and unfortunately colonizes people or sort of just live on people in our intestinal tract and then come out through like the rectum, can infect like the vaginal areas. So I think it's just important to mention that part as well. But with regards to what how they can like advocate for themselves or sort of raise more awareness as well, especially if they had a history of a previous loss. It's important to know that a mom who had a baby with a prior or had a prior baby who was infected with GBS would automatically qualify to get antibiotic treatment during the current pregnancy. So even if she's not tested in her current pregnancy, whether the baby's premature or even at full term, but for whatever reason she didn't get tested, if she had a history of a prior baby who was born who was infected with GBS, then she would automatically qualify to get antibiotics because she's would be considered higher risk for potentially having the bacteria.
Only if the baby also tested positive, not if mom tested positive but baby was okay?
Correct. And correct. So if the baby tested positive, a prior baby tested positive, then mom would automatically get it. If the mom tested positive previously, but the baby was okay, and now you're pregnant again a second time, and this pregnancy, the GBS status is unknown because she, for whatever reason, did not get tested, then in those situations, it's really a clinical judgment. There are certain, again, risk factors for moms with unknown GBS status that would qualify them to get treatment. For example, if the mom's GBS status is unknown, but she's had her membranes ruptured for 18 hours or more. That's typically what they use as the qualifier for like prolonged rupture of membranes, 18 hours. If the mom has a fever or if the baby is premature, less than 37 weeks, then those moms would also qualify to get antibiotics regardless, since they don't know what her GBS status is.
Right. Wow. Okay. That was a lot of information, but that was good. And that was also just really interesting to hear like the different scenarios and what that may or may not qualify you for. And I imagine for some of our listeners, that'll be really helpful because again, it can be, I can imagine probably overwhelming, especially if you have experienced a loss previously. So thank you. That was great advice. Is there any other, advice or things that I haven't touched on that you think would be important to mention in this context?
I think the future of GBS infection, I think it's important to know that this really is one of the treatments or one of the interventions that can honestly save lives. The rate for infection in babies or newborns with GBS has significantly come down since this universal screening and antibiotic prophylaxis has started a couple of decades ago. It's come down close to like tenfold risk. So I think this is a very important and very treatable or preventable cause of infection and cause of potentially stillbirth, but even other than it can cause babies to be very sick for a very long time. So I think the future of GBS is also an exciting field.
Yeah, what do you some research going on?
There are a couple of things. There's been a lot of ongoing research regarding probiotics for moms and how that could potentially prevent them from being, or not necessarily prevent them, but for lack of better terms, clean their colonization of GBS or prevent them from being colonized with GBS. The evidence for that is not very strong just yet. There is mixed evidence for it. There are some research papers that say it can be helpful in preventing the moms from being colonized with GBS. Other papers didn't find significant differences. So the debate is still ongoing regarding probiotics, but I think that's something that a mom can very easily talk with her OB doctor about to see what the benefit versus risks in taking a probiotic would be in her situation. The other very exciting sort of future for GPS research is a vaccine. There's a lot of studies going on regarding a vaccine that they could potentially give to moms, again, that would prevent them from being colonized with GBS and prevent babies from acquiring it, essentially. I think that would be especially even more helpful in lower resource countries where universal screening may not be available. Or testing may not be readily available for moms, then vaccinations might be a very good way to go.
Wow, that is, and it is, I believe it's National Immunization Month. So that was a good piece of information to know. That is amazing, especially for countries, right, where the access is a little bit different than it is here. To have a vaccine like that would be, I mean, as you said earlier, would save lives. Well, this has been awesome. Is there anything else that we didn't touch on that you think is important, or did we pretty much cover it all, you think?
The one last piece of sort of information that I'd say, and this is actually something that I unfortunately have recently encountered here at the hospital as well, are sort of the question about the risks of the antibiotics to the babies, or the thought process that just diet and nutrition could clear the infection. And if a mom is sort of trying to avoid getting antibiotics, I believe all moms are doing their best with all of the information that they have to provide the best for their babies. And I think it's important to just mention that this is a pretty safe intervention. There are no significant risks with getting these antibiotics, either to mom or to the baby. And it could potentially save lives.
Yeah.
So I would say that typically nutrition and diet, all very important. I think there is definitely a role for how nutrition and our diet can affect our microbiome.
Yeah.
But if a mom is known to have GBS, colonization, bacteria sort of living there, the risks that it can be transmitted to the baby are relatively higher, and the risks of the baby getting or sick from that colonization goes up as well. So this is something that could be very easily prevented with antibiotics that are much safer.
Mm-hmm. Yeah, and there's a lot of research to back that. So yeah, thank you for bringing that up. I sometimes forget that we have to think about that people might, not want an antibiotic. But as you just said, it could save lives. So thank you for addressing that. Well, this has been awesome. I just want to give a little quick disclaimer. I always forget to say this, but for those of you that are watching, please just remember that this is a conversation to raise awareness on this topic. This is not personal medical advice for you and your pregnancy. So I encourage everyone, if you are concerned about Group B Strep, have had it before, are thinking about getting pregnant again or for the first time, and just have questions, please, please, please consult your provider. These talks are here to help you feel empowered to be able to have those conversations with your provider. And just, Dr. Hanna, thank you so, so much for being here. I hope we can have you back again for another topic. This has been awesome. And if anyone has any follow-up questions, please feel free to reach out to Push and we can try to point you in the direction of some answers. And if you have not checked out our short film that Push recently was nominated for an award for, please check that out. Stillness is an illness. We have put so much work into raising preventable stillbirth awareness, and we are being seen for it. And we want more people to share. And it's conversations like this that will help us reach our goal. So thank you so much. And I hope everyone has a wonderful rest of your week.
Thank you for having me.